All right, this is a video demonstrating how to access an implanted port. At TMC, we have port access system kits that you can find in your supply room. While I'm in there are a couple other things. I'm going to grab 10 or 12 ml syringes for blood collection, our sterile saline flush, a BioPatch, a Lure-Lock access device, and then our green swab caps. Once I have all my supplies, I can go ahead and go into the patient's room. I'm going to verify the patient's name, date of birth, allergies. I've already looked in the chart and I know that I have an order to access the port. At this time, I'm going to remove the patient's gown and so I can assess the chest. I'm going to look at the implanted port. I'm looking for swelling. I'm looking for redness. I'm going to palpate for tenderness. I'm going to palpate and make sure that I can feel the port and that it's truly implanted in place. I'm going to ask the patient about their port use. Has it been used recently? When's the last time it was accessed? Have they had any issues with it? This patient does not have any issues with their port, so I'm going to proceed. I'm going to wash my hands and get my area ready. When I open the kit, I have two masks. The first mask I'm going to place on my patient here, and I'm going to turn their head away. The second mask I will place on myself. For video purposes, I'm not going to use it. All right, so I have my kit here. I'm going to open it. Save my gloves. And I'm going to go ahead and drop all of my extra items onto my field. All right, I'm going to wash my hands here and put on my gloves. So the first thing I'm going to do is grab my chlorhexidine. I'm going to squeeze to break the glass ampule, and I'm going to clean at the implanted port and around for 30 seconds. Okay, and it's very important that I let the chlorhexidine dry and at least for 30 seconds. So while I'm letting that dry, I'm going to go ahead and prepare my needle. I'm going to attach the Lure-Lock access device. I'm going to go ahead and prime my extension tubing. And I'm going to go ahead and get my skin prep pad out and ready, as well as remove my needle cover and place my BioPatch on with the blue part facing up. All right, so it has been 30 seconds. So at this time, I'm going to go ahead and access the port. Using my finger and thumb, I'm going to palpate the port, and then I'm not going to touch over the insertion site. I'm going to insert the needle until I feel the back part of the reservoir. And then I'm going to gently aspirate for blood return, which I see blood there, and I'm going to flush with 10 ml of normal saline. At this time, I'm going to go ahead and grab my skin prep pad, and I'm going to apply it to the area where my dressing will cover so that it sticks. This can stay in place for 7 days. So I am going to peel the backing off here. And I'll place it over the needle. And my tubing is going to come out of the little gap there. And then I can peel away the edges. And I'm going to use a couple of other pieces of this dressing. Okay, so this first part of the dressing over here, I'm going to peel off the side. And it's going to go under the tubing. And then on this part of the dressing, I'm going to do the date and time here. And I'll peel these away. And this just goes over my gap right there. And now I can go ahead and get my blood collection. I do want to waste and then draw the amount of blood that I need. And when I am finished with that, I will place a swab cap on the end of my access device. And then I will get my other piece of my dressing here to secure the end of my tubing. And then I'm going to take my specimens, or get my specimens sent to the lab and document.